the constriction. So I always call this like this. Marriage comes with a responsibility. It's wonderful to get married, but you need to stay in your marriage. So when you're using AI, it's very nice, but how to use it, stay compliant with AI. That's a huge topic. Generally take it for 3 hours. It'll be difficult to cover it in 15 minutes. I'll try to do a little good job of it. There are 5 problems that you come when you're talking of ethics in AI. How is the AI behaving? Is it biased? Who's liable for things going wrong with an AI? So suppose you treat a patient wrongly, you're responsible. Versus give a wrong injection, you have a vicarious responsibility. But if the AI tool behaves wrongly, will you take responsibility? That's a question. Are you sure about the security that we talk a lot about security, but how do you know the data is not leaking? And with an AI tool, a lot of people are going to make money. The company which makes the AI tool is making a lot of money. If things go wrong, will they pay that money or pay the money? And why should they make a lot of money when you're working with AI? So that is wealth inequality. And finally, this as insurance company decide whether your patient should be admitted or discharged. Will the AI tool decide whether your patient should be treated or how it should? The company which is making the AI, will they be in control of healthcare or will you be in control? Some very pragmatic questions have been asked. And this has been covered extensively well in this WHO article. It's a 300-page article. They've covered this very beautifully. This is one editorial which we just wrote, me and Dr. Kulkarni. It has just got published 15 days back. Responsible use of artificial intelligence in clinical medicine. I would implore you people to read. It's a 2-page article. We have tried to cover this in a very pragmatic and dogmatic manner, and we have tried to do a good job of it. This was a paper which was just got published 15 days back in Jyoti Sir's journal, The Race of Artificial Intelligence in Healthcare Competition, and we have tried to cover, and I'm happy that 2 co-authors, Dr. Shambhu and Dr. Harsh, are sitting here only. In this paper, we have tried to cover a lot about the ethics of AI in Indian scenario, in Indian ecosystem. So coming back to my talk, the concerns are, how do you know that the responses are right, or is it a bias? How do you know that the data that was used to train the AI was a qualified data or was it a junk data? Because you have no control of the data on which it was trained. How do you know that after using AI, your own skills will not degrade? So when you put in a lot of ECGs in AI and you start getting a diagnosis of infarction, you'll stop looking at the ECG. You'll tell your assistant, tool में डाल दे, infarct है तो ICU में डाल दे, नहीं है तो घर भेज दे. So that will be the level because you will yourself replace yourself with AI. Question is, when you're operating on a patient, you have to take a consent. I'll take a little 10 seconds and tell you, since I'm also working for the medical legal team and I'm attached to some courts. If you take a patient for operation and you want to do a hysterectomy, and this was a case in Mumbai High Court in which the doctor paid a huge penalty for it. So the doctor went ahead and removed the uterus. He went ahead and removed the ovaries. It was a selfing or pan-oophorectomy. The patient said, with whose permission did you remove my ovary? I'm 30 years old. So he said, we took permission of your mother, and this is in record. The patient said, then you should have removed the ovaries of my mother. How dare you remove my ovaries without my consent? And the court ruled in favor of the patient that if you wanted to remove her ovaries, you should have closed the surgery, come back, take her consent and come back. So that is the meaning of a consent. It's serious, something very serious, because if we do something, this is to protect the privacy and the concerns, because a patient owns his body, her body, and he or she has a right to decide what they want to do. So when you're using an AI tool, you need to take the consent of the patient before you use the AI tool. If things go wrong, how will you answer the patient? And I ask this question also because we are in NC stage. If you do not use an AI tool and the diagnosis does not come to the nth level, patient will say, why did you not use an AI tool? So I'll tell you my recent example. I had a patient recently whom I'd seen 4 months back for diabetes. Sugars were 420 and some 320. It's a Gujarati patient, came to my clinic. I put them on SGLT2, glibeparide, metformin, the standard cocktail that we decide on a type 2 diabetic. Patient sugar came to some 140 and 90. Patient was happy. Then they decided, allopathic medicines are not good for health. So they moved towards Ayurvedic. For 6 months, they didn't show their face. Then after 6 months, they got a little nausea, vomiting, and a little chest pain. So they went to a cardiologist who did an ECG. It was normal, sent home. Went to another cardiologist, ECG normal, went home. Went to a gastroenterologist, because the area where I practice in Thane is loaded with Hiranandani state and Lodha and all. So those patients decide whether a headache should be seen by a neurologist or a physician, and they first go to a neurologist. After 6 visits, they realize that it's an ophthalmic problem. Now they need to visit an ophthalmologist. So that is how the private practice goes. So after visiting 3 cardiologists and having got an echo done and ECG which was all normal, they realized that the sugar was some 420 and 520. So they finally said, Dr. Modi took care of her sugar, so let's go back to him. So they came back to me. So that is where I saw the patient and I thought things are not right. Why should he have a persistent nausea, vomiting? So I got an ECG which was normal, and I put that ECG in ChatGPT out of fun, and ChatGPT said this is non-STMI. and 3 cardiologists have told it to be a normal ECG. This is an actual case which I'm sharing with you. And having done that, I got the patient's troponin, which was highly elevated, got him admitted, treated him. Angio showed a 100% right coronary block, 80% right left main block. Patient got 2 stents put in, is doing well, is doing fine. Bottom line is, if I didn't use AI, I would have missed an honest TMI. So patient can take you to task saying, why did you not use AI for my treatment? Consent is important. Did you take the consent either way or not? So that's an ethical issue. Doctor-patient relationship gets highly strained if you do not work ethically. Now let's discuss about bias response. So we train AI to give the best results. So an AI model has been trained to increase the ventilator output if the patient's saturation is going down. If it keeps increasing the output till it develops a barotrauma or develops a pneumothorax, who will be responsible? So that bias response which gets done because of inaccurate and incomplete training. So that's where we play a role, and I don't want to advertise, but since me, Bharat and Harsh are doing this job, we are taking the AI tools and we are creating it ourselves. So we encourage you people to do that. When you create an AI tool, you know what medical science is. When an engineer creates, he doesn't know what medical science is. So that's where things go wrong. You can get a wrong answer because of wrong training of an AI tool. What about data quality? So what tool? Now, for example, Mayo Clinic is using a fantastic tool of picking up AKI, acute kidney injury and sepsis. And that's shown fantastic results, 23% reduction in the mortality rate. You read, there are many papers in NEJM, which is AI journal, which is one of the top journals for AI. When you read those papers, you realize that the mortality comes down before even the creatinine rises within 24 hours of the patient walking into the ICU in a very stable condition. Now that sepsis model cannot be translated to an Indian scenario and copy pasted because the scenario there is very different. We're doing an antimicrobial resistance AI tool which tells you what antibiotic is good for empiric therapy in an ICU in Las Vegas. You can't communicate it to a Gurgaon ICU, or you cannot take it to a metropolitan Mumbai ICU. For example, an ICU which does this kind of an AI tool in Hinduja Hospital in Mumbai cannot be translated to a Thane corporate hospital because the scenarios are different. So data quality fairness plays an important role. Automation bias, over-reliance on AI. When you're getting your EGFRs and therapies and prescriptions on a complicated brittle diabetes, type 1 diabetes, you're getting a fantastic prescription to prevent hypoglycemic attacks. You will start putting it on all your patients. You won't even bother to think. I give a very classic example. When we were doing our undergrads, so you have a patient of mitral regurg, rheumatic fever. So it's a systolic murmur. Correct me if I'm wrong. Now, a systolic murmur person with mitral stenosis, mitral regurg starts coming with a diastolic murmur. How can you get a diastolic murmur in a mitral regurg? When you ask this question, and I will ask you if any of you would like to answer in 5 seconds, a well-established mitral regurg patient starts getting a diastolic murmur. When can that happen? Any ideas? Anybody can answer? So a regurg is becoming a stenotic lesion. Why? Simple. You have got an atrial myxoma which is putting down. You have got an infective endocarditis which is a huge mass which is converting a regurg lesion into a stenotic lesion, right? Now that answer, if you rely upon AI and you don't use your clinical sense, how will you make a diagnosis? So a lot of automation bias occurs when you depend too much on AI, and that has started showing results in medical students. They're using their AI tools and mobiles to walk into the wards and not using the stethos. But the idea, informed consent I've already covered. It's a two-edged sword. Did you use a consent before you use the AI? Did you use a consent for not using the AI? Either way, you can land up in trouble. So there is something like that LLMs can also be used by patients. Challenge your diagnosis and they can be right. Google patient can challenge your diagnosis and is wrong. But an AI trained patient can actually make a mincemeat out of you because you could actually be wrong. And he can pick up Chidiachi-Hikashi syndrome which you can't pick up. He can pick up Down's phenomenon, which you can't pick up. He doesn't know what is Down's phenomenon, but his tool is telling you which you didn't know. So the output could be inaccurate, it could be manipulated, it could have an impact on certain individuals with disabilities and other ethnicities which have not been covered by AI because that tool has not been trained on that AI. It could manipulate an edict. So there was a case in Belgium where a patient actually committed suicide because the AI tool told him, the chatbot told him, you're useless, you cannot do anything. And he actually committed suicide, which was not required. AI tools can actually manipulate you and addict you. Like there were some games, where kids would jump out of the window to follow the orders in the game and they've committed suicide. An AI tool can tell the patient, boss, you've got cancer, your prognosis is very poor. You've got a very short life, which is not the case. Could be wrong, just as you could be wrong, I could be wrong. What about privacy? When you load all this patient's data on ChatGPT and Perplexity and DeepSeek, so much is being talked about DeepSeek, which is a Chinese tool, right? How do you know that data is not being manipulated by certain private companies to use that data for advertisement and creation? How do you know that you're right? I talked about doctor-patient relationship, that you have an eye-to-eye contact. But depending too much on AI could even deteriorate your contact further because you're not interested in talking to them. The patient is not interested in talking to you. You know, Google patients make life hell for you. An AI patient can make life even more miserable for you. He doesn't need you. So there's something called as an epistemic injustice and hermeneutic injustice. Epistemic injustice is when a person's capacity as a knower is wrongly denied by an AI system. So you know this is ischemic heart disease, but AI says, no, it's a normal thing. Hermeneutic injustice is when the bulk, a collective medical college says that this is Sheda-Higashi syndrome, but your AI says no. You say, no. AI is right, all of you are idiots. This was happening today. A Google patient says the entire hospital doctors are idiots. My Google is right. So there are a lot of responses called hallucination. As a medical term, it's also called as GIGO, garbage in, garbage out. You put in a wrong prompt, you'll get a wrong answer. So I have got EGFRs of 1340 on my patient from ChatGPT, which even is not possible. So if you ask a wrong question, you'll get a wrong answer. Try doing it with ChatGPT. Many times you get a very wrong answer. Like one of the papers I published, I got a reference from ChatGPT which does not exist, and Dr. Shambhu reminds me every day for that. See, because of you, something has gone wrong. So you can get wrong answers when you give a wrong prompt. And you know what is prompt engineering is nothing. So you have a very intelligent colleague. So let's say Dr. Shambhu is mine. I'll pick up a lady. Let's say Dr. Ritu is my very fantastic colleague and we are working together in a diabetes center. And I put in a very good case, but I forgot to tell her that HbA1c is 6.5, but I don't tell her that HB was 6. So she's going to tell me patient is well controlled. I'll say, no, you gave a wrong diagnosis. See, it's not a good control HB. Patient ka sugar itna high. How did you make a wrong? But I never told you the HP, na? What is her fault? So the prompt is not right. So an intelligent doctor can make mistakes if you don't give complete information. If you don't give the right prompt to an intelligent AI, it will give you a wrong answer. That is called GIGO, garbage in, garbage out, or hallucination. Technically called as hallucination. And that is where the role of prompt engineering comes. Prompt engineering is very important. And do you know that prompt engineers are being paid 7 lakh to 15 lakhs per month today in Mumbai? So I tell this in all talks. A couple of you could be interested in ditching your current profession and shifting to prompt engineering. After 6 months course, you'll be much better off than what we are doing today. So what is prompt engineering? I'll give you a small example. So when me and Harsh gave the MIT, Massachusetts exam, our capstone project was to create a model for Ola and Uber, because we were told which sectors have the maximum traffic, which customers are got the highest rating, which drivers have the highest rating, which time of the day has the maximum travel, and create a model to decide which avenues, which car, which driver, which patient should be given more importance, so Ola can make 25% more money. Everything depends on what prompts I create for that model. The whole business of the organization. Now you understand why they paid 15 lakhs to 20 lakhs per month. So if you implement your own AI tool for your own clinic, for your own share market, for your own tax return, which I do, you will see how things change. That's called data analytics. So take out the data of your 20,000, 30,000 patients and see which patients are coming regularly, who are payers, who are non-payers, who are on insulin, who are not on insulin. Do that kind of analysis with your own clinic. You will see a very different experience of how your clinic will behave after you understand all that. So that analytics you need to create. That is where prompt engineering plays a role. So data quality, data issues, data bias. Before they ring the bell, I'll move fast. LLM training is very important. Generic, we call it generic. ChatGPT, Claude and all. They're not trained on medical data. So they give you any answer because they're full of internet searches. But when you train a chat model, which is an intelligence model, on only restricted papers, restricted tools, it will give you answers from that. So when me and Harsh and Shambhu are writing review summaries of the papers that you just saw, which were written by AI, we have trained ChatGPT to write a review article only from the 10 articles that we give you, or only the 50 articles that we give you. So now a lot of eyebrows are going up. Oh, that is the secret. So we can write a very ethically accurate article because we tell ChatGPT to pick up information only from these 20 articles. Do not do a general search. So the output has to be accurate. So the data model, the data training, accuracy, all depends upon how you work. So it's not a rocket science. A lot of your intervention is required. And can you depend upon the patient usage of LLM and how much you can depend on that? A big question mark over there. So there are a lot of issues. There is something called as a black box diagnosis. Now that is called as a saliency. Now look at the saliency map. The first tool picked up the torso and the head of the, this is an army light tool. It was picking up enemies. It could target the torso and the leg and send drones to shoot the army. Whereas the second tool started picking up trees and bushes and not this thing. So if you send drones to kill the trees and bushes where the enemy is hiding, you would land up in trouble. So the saliency map, how you train, is important. You can create havoc if your training model is not right. So safe failure modes in AI, just as when you do drug analysis, you do phase 1, phase 2, phase 3, phase 4 studies, you make sure that the drug has been analyzed in detail. How do you know that your AI model has been analyzed in detail or not? Have you validated the model? Have you checked the training models of your AI tool? That all plays a very important role. What about the long-term side effects? So an autonomous ventilator can keep oxygenating the patient irrespective of the patient going into oxygen toxicity. A lot depends upon your model, upon your oversight, about your implementation, about your migration of the model, on the companies that is making it, the engineers and the doctors behind it, the validation behind it, and if you're upgrading your model on a regular basis or not. And do you know that running ChatGPT is not a time pass thing? It's a very costly thing. It is costing a lot of money and resources to the company OpenAI which is making it. They spend a lot of money. Let's talk about labor and employment. We feel ChatGPT or AI will not replace professionals. The truth is it is otherwise. Look at the way that jobs have been taken away by Amazon and Meta because of AI implement. Look at the numbers. Just finish. Look at the numbers that the jobs, they say the jobs will not be disappearing, but Elon Musk has very clearly shown a lot of jobs have been replaced, and he has gone to say that maybe after 5 years, Dr. Shabu, me, Harsh and Dr. Ritu, all of us will not be here. Our clones will be running the conference and we would be sitting somewhere else. So when I said lady doctors could have a good time at the beauty parlor, 2 ladies came and told me, thank you very much for saying that. So maybe the next DRS conference, Dr. Manoj and Purvi will organize it, but we will be having Vatata Vadas and our conference will be running. That is a reality with AI. And I would implore you to see the YouTube video of Shashi Tharoor talks to Shashi Tharoor. You can't and check Shashi Tharoor talks to his clone, and trust me, you can't make out who's the real Shashi Tharoor. So there is cybersecurity risk. Remember one thing, in training an AI model, you're using 7 million liters of water. You're using 3.4 gigahertz, which can power 300 US households for 2 months. Finally, concerns about dominance, concerns about dangerous algorithms, concerns about the legality. I'm not going into the legality. It is a huge topic. No law in the world is yet clear on legality. We are stuck with the DPDT Act. We do not have a clear principle of how legality should behave if an AI model goes wrong. There is a lot of work remaining, a lot of things to be discussed, a lot of FDA regulations to come in place, a lot of Indian regulations to come into place. And this is our ex-minister, honorable minister who would deal with it. Works is in progress. Sam Altman says that we would work with you guys, but we are not clear where we are entering. It's a nascent forest we are yet exploring. So I just wanted to elevate your this thing, to behave responsibly, to be a little concerned before you surrender yourself to AI and let AI take over you. Don't let AI take over you. Use it responsibly, maturely, and use it to help you as an additive intelligence and not to replace you. So thank you very much for giving me this opportunity. And I could not cover the topic. It's a huge topic. I just wanted you to just pay attention and go through it on your own. Thank you very much.